Hello, everybody. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Gachoa, and I'm the owner of PAR5 Physical Therapy here in Randolph, New Jersey, and I have partnered with them to give you an easy and educational workday session. So today's session is how to get healthy shoulders for tennis and pickleball. So a little bit about me. I've been in the PT field for over 25 years now. I received my doctorate in physical therapy from Mercer College in Dobbs Ferry, New York, and a BS in exercise physiology from Rutgers, New Jersey. So I also am an orthopedic clinical specialist, a certified golf medical professional, and a functional movement techniques specialist. So anyway, let's get this started. Without further ado, just go ahead and use the chat as we're getting into our slides here. There's a lot of stuff to cover, a lot of information on how to get healthy shoulders for tennis and pickleball. So just like every other class that I've given, because I'm a medical professional, I have to put this disclaimer up. So the stuff that we're going to talk about is very useful, very helpful information, but it is designed for a broad population. So if you're dealing with something specific, make sure that you get a thorough physical examination so that you can address all the underlying factors that might be connected to your problem. I had this other client the other day who had like hip pain, and he came in and says, I've been watching all these YouTube videos to do this. It's probably my IT bend, my tensor fasciatum, whatever. And we got into this physical exam. It's like, well, you know what? All the stuff those videos are telling you to do, like stretch and roll out, you don't need them because you have good flexibility. What you really needed is some strengthening. So make sure, just be cautious with a lot of this internet information, that you get specific things for yourself. Now, if you remember anything from all my talks, all my classes, you have to remember this one thing. The body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is the result. So if we break it down here, the shoulder is supposed to be a mobile segment. The next segment that's closest to it is a shoulder blade. That is actually a type of joint. The shoulder blade interfaces with the rib cage and the thoracic spine, and that needs to be stable. I like to say that the shoulder blade is the foot of the arm, right? If we don't have good stability through that shoulder blade, there's way too much tightness or more stress on the joint itself, because the ball and socket of the shoulder joint is very mobile. It really relies on the muscles around the area to give it its stability and strength. So, and then looking downstream, if we're looking at the elbow, that needs to be stable. And then the wrist needs to be mobile. If we look at the thoracic spine, that needs to be mobile. So this alternating pattern of stability and mobility needs to be intact with every joint, because if one of these parts are not doing its job, it typically forces the next segment to reverse its role. So if the thoracic spine is not mobile, if it is rounded and tight, then the shoulder blade turns into a mobile segment. It's not as stable. And then everything down the chain into the arm kind of gets mucked up. All right, so to talk properly about the shoulder, let's just kind of dive in really quick about what it is, right? So the shoulder girdle, how it connects to the axial skeleton, the rest of the bones of the body, is right at that AC joint. That AC joint, that circle right here, is where your collarbone meets your sternum. That's the only bony attachment of your arm to the rest of your skeleton. Now, that collarbone goes all the way out to what we call the AC joint, the acromioclavicular joint, out on top. That's important because that's a spot where it's a lot of wear and tear, gets arthritic changes, especially with age. And then we have the glenohumeral joint that goes through here. That's where the ball is actually the socket. It's a very shallow socket and a large ball. So, that's why it moves. Unlike the hip, which is another ball and socket joint, but that ball, that socket is very deep. So the hip is not as mobile as the shoulder. And then we have that big red circle, which is the scapulothoracic joint. Again, as I mentioned that earlier, that's where the shoulder blade interacts with the thoracic spine. Now, diving in deep, we have the scapula, the shoulder blade, we call it, the humerus, which is your arm bone, and then the clavicle. So all these bony parts, we have like, the one thing I want to make note here is that the ball is not very round. It has this big, greater tuberosity, this bump on the outside. You can see it over there. that big bump oftentimes can come up against the acromion, which is that hook-like structure at the top. Between those two things, those two bones, are a bunch of tendons, and you can get irritation or impingement. So this is a little bit more with the muscles in the area. And the rotator cuff muscles are basically the smaller muscles that come from the shoulder blade and insert into the humerus, the arm bone, and keep that ball in the middle of the socket, in the axis of the joint, the middle of the axis of the joint. If that muscle or those muscles are firing incorrectly or they're weak, if that ball comes off the axis of the joint, functions improperly, then we've got tendon issues. So I'm gonna pull up, hopefully this video plays, a little bit about some typical things that I see in my practice. That muscle on top with that tiny tendon that you'll see is kind of frayed is a supraspinatus tendon. That is one of the most common ones that gets impinged. But what is not shown in this video is the bicep tendon. And that bicep tendon is in the front. And that also goes underneath that ridge, deeper to the that supraspinatus tendon, and also can get irritated as well. So how do we prevent all of that stuff so we have good, healthy shoulders and ability to hit overheads, backhands, forehands, whatever we want, even those things? We want to work on thoracic mobility. We talked about how the thoracic spine needs to be mobile. We need to talk about and touch on scapular stability. That thing needs to be strong, right? And be able to stabilize the arm. And then the rotator cuff strength, all right? So let's go through a quick little self-assessment, some soft tissue mobilization, joint mobilization, some stretching and strengthening. So hopefully we can get through all this stuff. There's a lot of stuff because the shoulder is probably one of the more mobile joints of the body and very complex. So let me put this down and we're going to get through all this stuff. Maybe pull up my 2-shot here. And we've got, pull this down. We're going to get on the floor. All right. So I'm just going to get on the floor here just for convenience for this camera angle and stuff that we're going to be doing later. But basically, you can do this sitting, standing, doesn't matter. The first test, and these are a quick little test to determine what could be exactly going on with your shoulder. You're going to take your arm, put your fingertips on your opposite shoulder, sit up nice and tall, and bring your elbow to your face. You should be able to do that elbow to your face on both arms evenly and without pain. And this does not count. Head down, it does not count. Head's got to be neutral, elbow's got to be nice and high. So if that's pain-free, that rules out any possible impingement. The other one is a Neer's test, what we call it, which is basically taking the arm, I'll show you over here, and then bringing it up straight. Now, normal range of motion, full range of motion is being able to bring your arm overhead, getting that bicep close to your ear without hyperextending your back, all right? So that's key. We want to be able to have full range of motion without hyperextending your back. So if that is pain-free, thumb up, we're going to test that motion, thumb down. We're going to turn that thumb down, raise it over your head, check the other side. That's another impingement sign. If there's pain with thumb down versus thumb up, then that could implicate a rotator cuff impingement, all right? Another one is called a Speeds test. It's basically to test out for that bicep tendon. If that gets irritated, you're going to put your palm out in front, try and straighten your arm as much as you can, and then push your hand down. If you can maintain that with good pressure and no movement, then that's good. If there's pain or that thing kind of drops, that could implicate the bicep tendon. All right? So 3 quick tests. Make sure that you have full range of motion. If you don't, then hopefully these next things were going to help. So I've got a foam roller. You can pick these up anywhere. They're super ubiquitous. We can put this on the ground. Now, we're going to work on thoracic mobility. The thoracic spine, where our rib cage is not good in this position. That locks up the joint. And then if I try and bring my arm overhead or swing or use my shoulder blade muscles, it's a faulty posture or faulty position to work from. We want to have a more neutral posture. So this is a good anti-sitting posture mobilization. You're going to take that foam roller, you're going to be sitting down. We're going to place this on the lower ribs. Everyone that gets on here usually starts right here on the upper ribs. No, we want lower ribs. And if you have a foam roller and you're trying this at home, you're probably saying, ow, this is uncomfortable, which is okay. If there's a lot of sharp pain, then we kind of have to make some adjustments, make some modifications. So again, general advice, not specific to what may be bothering you. So, but anyway, this is to mobilize the thoracic spine. We're going to keep the hands behind the head. Elbows forward, keeping the shoulder blades away from the center. And then we bring the head and shoulders back. And as we do this, we're mobilizing the lower thoracic spine to extend, right? So what I want to do is be able to go back, but not release the abdominals and just hyperextend my back, right? So if I feel like my lower back is unlocked, we don't want that. It's like a tug of war. This has to be pulled down while the upper half gets pulled back with the weight of your upper body. So we're going to do that a couple of times, maybe like, I don't know, about 5 to 10 times. And then we're going to scooch it down without moving my hands, keeping my elbows straight or elbows forward. I'm going to lift my hips, slide it up a little bit. So I slide my body down, the foam roll rolls up on my back, and I repeat at the next segment. And I'm going to keep doing that all the way up my thoracic spine. Again, keeping in mind that we pull the ribs down so that we can have this tug of war, this seesaw where I'm mobilizing the thoracic spine, not just borrowing from my lower back. Again, that stability, mobility pattern. If one part is limited with its mobility, the other part, which is your lower back, may compensate and come back into play. So we want thoracic spine extension with the foam roller. Okay, so we'll do that. I typically have people do that for 1.5 minutes to 2 minutes, depending upon how many segments they find it to be tight and limited. If you find one that's tighter than the others, you want to spend more time on that one and do more repetitions over there. The next one is going to be using this foam roller to roll out this latissimus muscle. The latissimus muscle comes from the lower back, wraps around the side, and then goes into the front, which, if it's tight, can really impinge or restrict your ability to do this overhead stuff, especially if you're going to do a kick serve in tennis or an overhead in pickleball. So to do that and release this overhead position, we're going to lie on your side with the foam roll in the armpit pretty much. Our goal is to search for that tender spot between the ribs and the shoulder blades. So I'm going to roll forward and backward, probably find something interesting there, and I'm going to kind of shear that out, right? So we have all these layers of tissue, all these groups of muscle that are smushed together there that need to be able to slide on one another. So we want to create some shearing effect here to loosen up that interface between layers of muscle. So I'm going to roll forward, maybe get another piece here, maybe go backwards, get another piece. And I could move this up and down, adjusting where I feel the tightest or the most restricted or the most uncomfortable. That's a good spot. And then if we can, we're going to pin down that spot on the muscle. Keep it nice and tight, pressure on, turn my palm up, and then sweep my hand overhead while maintaining pressure on that lat muscle down here with the foam roller. This is called a pin and stretch. I'm pinning down the muscle and I'm stretching out the other end as that lat muscle inserts into the front part of my shoulder. So I'm going to do that for 1.5 to 2 minutes. All right, and I can repeat that on both sides. So that's our lat foam roller. The other one that we can do is a super simple one with this to stretch out the pec. We're just going to sit right on the edge. Hopefully I got my camera here, and I'm going to lie back here, right? So I've got my head, neck, mid-back, lower back, hips on this foam roller. Your size of your body may vary depending upon how much you fit on here, but basically you're just going to relax and put your palms out like this. What I'm using here is just using gravity to stretch out my pec, all this front muscle, my deltoid here, to kind of reverse the often hunched over position. Now, palms up, that's important, not palms down, palms up, keeping the palms on the floor. We're going to find an angle or find a position where we have a good stretch, but I could still maintain my hand on the floor. If I go too high and I'm kind of like hovering, then that's way too much. We want to be able to find a spot, maybe out at 90 degrees, where I can kind of hang out here and just let my body relax. And because this is a very easy passive stretch, I usually have people hold this for about 1 minute. Okay, so that'll counteract a lot of that tightness that happens when our body adapts to our positions that we typically put it in. Our posture, if we're here forward, kind of doing stuff in a sitting position, all of this can get really tight, so we want to reverse that. All right, so a lot of stretches here. The next one we're going to go into is using a band to strengthen muscle. So I'm going to have this band here. Again, just because of the camera, I'm going to get on the floor, but you can do this in standing. First thing is picking a band that is applicable to this, right? So I have this super band here. It's about 3 feet in length or so. It's got this loop, but you can use any type of exercise band, exercise tubing, doesn't matter. So the first one's going to be for your shoulder blade muscles, your rotator cuff. You're going to grasp that with a palms up position, this supinated position here, and then bring your elbows back and down, keeping your elbows nice by your side. And what you're going to do is hands higher than your elbows. You're just going to pull your shoulder blades together. Oh, there's my camera. All right, so as we're doing that, we're just kind of rotating the hands out. Shoulder blades come together. And I would like to do a high number of repetitions. If we need more resistance, I'll grab 2 of these things, double up. But basically, as I go out, I don't want to lose this angle of my elbow. I want to be able to maintain that angle so that I don't extend at the elbow to get more range. So I don't want to go like this as the band goes down, my hands go down. I want to keep my hands high so that my hands stay higher than my elbows, and that forces my shoulder blades to do more work. Anywhere between 12 to 15 repetitions would be good for this, and then 2 to 3 sets. If you're doing this prior to playing, this will warm up your shoulder blade, make sure that those backhands are nice and powerful, and you can do this for about 30 seconds at each position. The next position is going to be at 90 degrees. So we have rotation here at neutral, the elbow down, and then we have this rotation up top here in this 90-degree abducted position. This is more complicated because you have to stabilize the shoulder. But in that position here, I can hold my band out in front, keep my elbow at 90 degrees, and I just rotate vertically. So this hand is stabilizing. This is my hitting hand. I'm a right-handed player, so I'm just going to rotate through here. So this is the front view, right? So hopefully I can get my elbow at 90 degrees and maintain that 90 degrees as I go up and down. Got the side view over here, right? So hopefully you can kind of see how that elbow stays in line with my shoulder. And we want to also do like 12 to 15 repetitions of that. So that's external rotation. All right, the other one we can do is just basically a pull apart, where we have the band out in front and then just pull the hands back, pulling the shoulder blades together, right? So we want to be able to get those shoulder blades and the muscles in between the shoulder blades in the mid-back more warmed up. So this will help warm up your shoulders, get your shoulder blade, your rotator cuff warmed up and strong so that you can have healthy shoulders as you're playing. The other one I like to do is a pass-through, which is basically taking the same band, coming from the band out in front, moving the arm over your head and behind, and getting that band to touch the hips in the back. So just kind of warming up the shoulders. I could do, 5 to 10 of these to warm up the shoulder, rotating through there. And we could also do like around the world type of motion here, where one hand stays still, one hand comes up, I bring the band behind me, and then one hand comes over and I bring the band in front of me. I could reverse that, going backwards, take the band back, bring it forwards, bring the band in front. Now doing it with the band allows me a little bit of a cheat if my shoulders are tight, to create more or less tension. The more tension there is, the more difficult that will be. The less tension, the easier it will be, okay? So those are quick, easy exercises that you can do even prior to your games in pickleball or tennis to warm up your shoulder and keep your shoulders healthy. All right, hopefully you found that helpful. Let me pull up the, go back to my front camera here. All right. So good little quick, easy exercise routine here to maintain healthy shoulders for tennis and pickleball. I'm going to give it a couple seconds here. I'm going to pull up the chat, make sure we have any questions here. Let's see here. One question is, can you do the band exercises for shoulder blades with weights instead? All right, very good question. I get this all the time. I'm going to grab a dumbbell, and this is important. With the band, the resistance is the band. As it stretches, you get the resistance. So with the weight, the resistance is gravity. So if I'm going to do an external rotation with the band in this position, it does not work because the resistance is down. What I'm doing like this, and I'm just taking my rotator cuff and I'm wringing it like a towel, which is not good. So this does not work, okay? If we're going to do it With the weight, we have to get on the floor, lie down sideways, and then do it this way. Okay, so again, the movement, that external rotation, is against gravity. Regardless of using the weight or the band with doing the external rotation, it has to be with an elbow locked angle, 90 degrees, and not moving the elbow over, open or closed, right? So we want to try and maintain that elbow position as we do that external rotation. All right, so the other ones, this one might work, but becomes more, I guess, advanced because you really have to stabilize that elbow as you're doing this with the weight. I like doing all of these rotator cuff muscle exercises with the band because it really directs the force of rotation versus trying to change your body position to accommodate for the gravity, which is the resistance with the dumbbell. All right, we got another question. Let me pull down my chat box here so I can see. Could you rest your elbow on something? You sure you could? Yeah, you could probably just put it on the table. But if we think about it this way, the force that we're doing to get that rotator cuff muscle, that supraspinatus, target that and not allow any other muscles to compensate. It has to be specific in terms of the direction of resistance and the direction of motion, right? So again, with the weight, that weight is only vertical. The resistance is only vertical. When I am in this position with the weight, there is no resistance, no work by that rotator cuff muscle, right? Because that rotator cuff muscle rotates backwards. That's why it's much superior to do that exercise with the band, because the band is pulling my hand forward and the rotator cuff muscle pulls me backwards, all right? So very specific for that supraspinatus muscle, that specific rotator cuff muscle that we want to strengthen using a band. All righty. Any other questions for me? All right, you're welcome. All right, let me just see. I'll give it the 30-second countdown, and then we're going to wrap things up so you can enjoy your Tuesday. All righty. Okay, no other questions. Cool. Thank you. Thank you. All right. Say we have a drive. What does that mean? That question. Say we have a drive. That's confusing. Like to restate or unmute yourself and say what you're supposed to say. Say we have it. How long would you recommend? How long ahead would you recommend these? So you're going to play tennis, you're going to play pickleball, and it's like 25, 30 minutes away. Do you do these things at home or do them at the court? I would do them at the court right before you play, right? Because you think about when you're going to play, you never want to jump in your game cold. You want to warm up. You want to make sure that your tissues are well perfused with blood, they're hydrated, and they're loose. So just like you're going to go on the court or, hit a couple of volleys, baseline drives or whatever, or, I think there's another class that I did, and you'll probably be able to find this on the Better Spaces apps that I did the perfect way to warm up and stretch prior to pickleball or tennis. And actually, I might be doing that next month. I don't know. We'll see. A little preview for you. But yes, you want to be able to do these exercises right before you play. So you're warmed up, those muscles are primed, and your central nervous system says, let's go. All right. All right. So no other, didn't want to do that. Okay, cool. All right. So no other questions here. I'm going to let everybody sign off. So thank you for joining me today. You can look for this session, like I said, and many more on demand on any of the Better Spaces apps. I'll be back August 1st. That's next week on 3 drills to improve your running efficiency and reduce your injuries. So you're going to learn the 3 secrets to improve your running times, your pace, and run longer with less effort. If you have any questions, you could email me at paul@par5pt.com or team@betterspaces.com. Thank you for coming again, and be well.